Right. The first system that we're going to dive into is the skeletal system. The two main functions of our skeleton is to give us our recognizable human form. If we didn't have our skeleton, we would just be blobs that really would not be able to get around without the skeletons, and we wouldn't look like what we do today. Another vital function is protecting vital organs. So, for example, our skull protects our brain, our thoracic cage, which has our ribs, protects our lungs, our heart, and some of our great vessels. And it contains these four various different types of structures. The main ones being the bones. There's approximately 206 of them in the adult body. In infants and children, there actually is more bones, but over time, they gradually fuse together into one bone. We have ligaments that attach bones to bones, and these are particular around joints, because where our bones tend to move, we want to make sure that the structures stay together and don't float off. Then we have tendons, which attach the muscles to the bone. So in order for us to move, we need our muscles to contract. But if there was no point of attachment to the bones, then our muscles would have a very hard time moving those bones around. So we wouldn't be able to walk, we wouldn't be able to pick up objects. Then we have cartilage, which is a smooth connective tissue that covers the ends of the bones at locations of mobile joints. So for example, your elbow. The ends of those bones have cartilage on it, and that provides cushion for the joint, as well as smooth movement of the joint. So if the cartilage didn't exist, our bones would grind across each other, which is not necessarily the most comfortable. And that's a big problem with people who are dealing with arthritis. Their cartilage is essentially non-existent, and those bones grind against each other, and they can start to develop bone spurs, which do not help the problem at all. We can break our skeletal system into two main regions. The first one being the axial skeleton, and the second being the appendicular skeleton. So axial, it refers more to the middle of the body. So we have our skull, we have our spinal column, and we have our thoracic cage here. There are multiple bones that make up our skull, and the main purpose of this is to protect the brain, protect the eye, and provide us a mechanism in order to chew and consume food. When we look at the bottom of the skull, on the occipital bone here, kind of in the color blue, we have this major opening. It's called the foramen magnum. And this allows the brainstem to exit the skull, connecting it to the spinal column. If this area did not exist and it was closed off, our nervous system would be just contained in the skull. There'd be no way to get information in or send it out to the various different parts of the body. So this is a very important area of our skull. Then we come over to our spinal column. It is made of 33 vertebrae, And it is very important for you guys to know the various regions that are labeled in different colors here and the number of vertebrae that compose each of these regions. So the first area is the cervical vertebrae, and there's 7 here. When we refer to vertebrae, we refer to the letter, which would be C, and the number. So C1 would be the very first cervical vertebrae. Then C7 being the very last. The first 2 vertebrae, C1 and C2, have unique names. The C1 has axis. My apologies, atlas. Atlas is from Greek mythology. And if you know anything about Atlas, he was capable of putting the world on his shoulders. So when we sit here and look at it, C1 holds the skull, which contains the brain. And that's why we gave it C1 the name Atlas. Then C2 is axis. And this one is the pivot point for the skull. So when you turn your head left, right, up, down, C1 is pivoting around C2. Then the rest kind of fall into place, C3, C4, C5, all the way up to 7. And they don't have any particularly special names. Then the next section is our thoracic vertebrae. There's 12. And this makes up the backside of your thoracic cage. If you remember that there are 12 thoracic vertebrae, you will remember that there are 12 ribs of our rib cage. Then we have our lumbar spine, which is our lower back, and there are 5 vertebrae here. Then the next one is our sacral vertebrae, or sacrum, and there's 5. Now, this area is a little bit different compared to the first 3. All of these bones are fused together, where we have a certain level of flexibility in our neck, upper and lower back. We don't have that luxury in this region. The sacrum makes up the backside of the pelvic girdle that we will talk about in more detail. Then the last one is the coccygeal vertebrae. There's approximately 4. That's always up for debate, but our textbook will stick with 4. And these are, again, fused together, and this makes up our tailbone. If any of you have fallen on your tailbone, you will know it's not the most comfortable. But again, it's a tiny group of small bones. Then we hop on over to the thoracic cage. So we have 12 ribs. As you can see, they're all numbered 1 through 12. And we have our sternum here, which is a flat bone that is in the middle of our chest. And the ribs come and are connected by cartilage to the sternum. We have our collarbones, or our clavicles here. Let's see. Then on the bottom of the sternum, we have the xiphoid process, which is a small protrusion that is sticking off of the end. We have the body of the sternum and the manubrium, which is the head of the sternum. So when we are going in descending order, we have the manubrium, body, then the xiphoid process. Again, these bones serve the main purpose of protecting our lungs on both sides and our heart in the middle here. the sternum is interesting because when we are performing CPR on patients, we're pushing down on the sternum and the heart is just beneath the sternum. So it is kind of nature's way of giving us a way to do effective compressions on the heart, allowing us to get as much blood out as possible when someone is in cardiac arrest. Now, when you guys are thinking about your spinal column, you do need to know the specific regions in descending or ascending order and be able to tell us how many vertebrae are in each section. There are various mnemonic devices that you can look up online that can help you remember cervical, thoracic, lumbar, sacral, and coccygeal in order. Then a good way to try and remember how many are in each one, I kind of think about meals throughout the day. So at 7 in the morning, you might have breakfast. You'll have lunch around noon. You'll have dinner and dessert around 5 p.m. And then obviously you need a late night snack at 4 in the morning. So you'll have one at that time. You'll find a way that works for you, but that is just one way that you can try and memorize how many are in each one. Now we're going to look at the appendicular skeleton. So the first part we are looking at are the two upper extremities. This is made up of 3 major long bones. And when we refer to long bones, as you can tell, they're self-explanatory. They're long in length. And you should familiarize yourself with the names of these. So the upper arm is referred to as your humerus. Then the 2 bones in your lower arm are the radius and the ulna. Okay. As you can tell, there are many different anatomical regions that you can get to know, but don't focus on the very specific details. It's important to know the long bones first. Then when you are so inclined, try and memorize and get to know these unique features between the bones. So the head of the humerus here connects to our shoulder. So it's a part of a multiple bone structure called the shoulder girdle that we'll look at it on the next slide. Then the radius and ulna here. The radius is an interesting bone. The best way to remember where the radius is at is looking at the location of your thumb. Wherever your thumb is turning when you rotate your wrist, the radius bone is following it. And the ulna is that pivot point where the radius kind of rolls around on. Then the olecranon process, this actually is that pointed part of your elbow. And so that's just the fancy name for that part of your arm. As I mentioned, the pelvic girdle is made up of several different bones. We have your scapula, which is your shoulder blade. We have the clavicle, which is your collarbone. And then you have your humerus and the head of the humerus. All 3 of these areas meet together to form that joint or your shoulder. They are held together with ligaments, keeping everything in place. If there is damage to any of these bones, we lose that ability to use our arm and our shoulder, because This keeps everything together and provides the necessary structural support in order to bear the weight of whatever activity we are doing. So, big thing to know are the three major bones that make up the shoulder girdle. Then we have our hands and fingers. So here is our radius. As I mentioned before, it lines up with our thumb here. So as we rotate our hand around, just follow your thumb. You'll know where your radius is at all times. And here's our ulna. Now, we can break our hand into three unique regions. First is the carpals. So this is a mix of multiple little bones that kind of makes up our wrist. You do not need to know the names of each one of these little bones. They all have unique names, but that is not necessary. Then we have our metacarpals, which help make up the palm of our hand. So the bones between your wrist and your fingers would be your metacarpals. Then your fingers are referred to as phalanges. The big thing that you need to remember is, again, which order carpals, metacarpals, and phalanges go when you are looking at the wrist and your hand region. And now we're going to look at the lower extremities. Much like our arms, our legs are made of three major long bones as well. Not pictured is our patella, which would be our kneecap. The first major long bone is our femur. This is our upper thigh. And this bone is very important. This bears the majority of our body weight. It is stronger than steel, and it takes a lot of force to break the femur. And when we go into trauma, we'll talk about how these will present. Then our lower leg contains the tibia here and the fibula. Unlike the radius and ulna in our arms, these bones don't necessarily rotate around each other very much. They just provide the much needed structural stability that our body needs when we are moving around. So again, the big thing we want you to recognize are the names of the three major long bones and what makes a long bone what it is, and it's just the length. And just like our shoulder girdle, we also have a pelvic girdle. So the area where we have our hip joints, where our femur meets the pelvis and where we can walk around. It is made of 1, 2, 3, and 4 major bones. And yes, this is one of those regions where we have multiple bones that ended up fusing together. So when we look at this lateral view of our pelvis, we have these 3 major bones. So we have the ilium, which is the wing-like structure. And we have the iliac crest. And we'll talk about more in trauma of the significance of being able to identify the iliac crest. Then on the front aspect here, we have the pubis. And then the kind of the lower backside, we have the ischium. Then here's our sacrum, the 5 bones that are fused together. Then there's our little coccyx or our tailbone. There are major blood vessels that run through our pelvic area, so fractures to the pelvis can be very dangerous. We have our femoral artery that runs through here in our femoral vein. And again, if we have breaks in this region, we run the risk of lacerating these vessels. Now, we have something interesting here. The male and the female pelvis are slightly different. That is because of the physiologic function of the female one that differs from males. Remember, females, they have to be able to have certain level of flexibility when they are carrying a child. And in order for that child to pass through the birth canal, their pelvis has to be flexible. Right here, we have a tiny piece of ligament, or my apologies, cartilage. And it's called the symphysis pubis, or also pubic symphysis. During pregnancy, hormones and other chemicals in the body send to this particular piece of cartilage to expand during pregnancy in women. And this allows the pelvis to widen out. And if you have ever heard that pregnant women might be a little bit unsteady on their feet because their joints are loose, this is a big reason why. The pubic symphysis relaxes, allowing this particular area to open up wider for the infant's head to pass through the birth canal. And just like our hand, our foot is broken into 3 major regions as well. So our hand had carpals, metacarpals, and phalanges. But our foot kind of changes it up slightly. So we have our tarsals, which are in this area. We have our metatarsals that make up kind of the arch of the foot. And then we have our phalanges, or our toes, here. Again, no need to memorize the specific names of all of the tarsal bones. Just know, again, which order you go from tarsals, metatarsals, into phalanges. So joints are points of contact where bones meet. And we have various different joints throughout our body, but the 2 major ones that we have are hinge joints and ball and socket joints. So hinge joints, the motion is restricted to really one plane of motion. So if you're looking at the knee here, it only goes back and forth. It's not going to go side to side or twist around. Where ball and socket joints, like for example our shoulder, we have a unique range of motion that can kind of go in circular, up and down, and various other directions. Then to wrap up the physiology of the skeletal system, don't forget, it gives us our shape. It protects fragile organs, allows us to move. It also serves as a storage of calcium. And another function that a lot of people are not familiar with is that it helps create blood cells. So our bone marrow is contained in our bones, specifically our long bones. And our white blood cells develop there, our red blood cells develop there, and it's very vascular areas because of this. Then our bones, as you recall, are made of calcium. If your parents told you that drinking milk helps you have strong bones, they aren't completely wrong. There are other ways of building up that calcium, but milk is a good start. All right. So that wraps up the anatomy and physiology of the skeletal system. The next part will be our muscular skeletal system.